Hello and welcome back to our Saturday Night Live. As usual, I'm Dr. Surabhi Mitra, your host. I'm a psychiatrist and the moderator for this show. Today's topic is related to women's eye health. Now, मुझे आज बहुत लोगों ने जब मैंने इसकी लिंक फॉरवर्ड की सबको कि आइए आज हमारा शो देखिए, तो बहुत लोगों ने इसके ऊपर चर्चा की कि Surabhi always talks about the society being gender neutral. Then why is she specifically talking about women's eye health this time? So let me inform you that April month was chosen as Women's Eye Health Awareness Month. And that is the reason we chose this as the topic. And for this, we called two visionaries who would be speaking on this topic and clearing the air as to why women's eye health is important and whether or not there are certain differences in between women's eye health or men's eye health and what are those differences. So for this, we have two esteemed panelists. Number one is Dr. Shubhangi Bhave, who is a pediatric and general ophthalmologist since past 40 years. She is a GMC Nagpur alumnus. She has publications in various national journals. Recognized PG teacher, that is a postgraduate teacher for Nagpur University in ophthalmology. She was the president of Nagpur Academic Ophthalmologic Society in 1996 to 1997. She was the president of Vidarbha Ophthalmic Society also 2006-2007. Scientific Committee Chairman of Vidarbha Ophthalmic Society in 2010 and 13. At present, she is practicing at her own clinic, that is Drishti Eye Clinic and Squint Sector in Nagpur. She was the president-elect of SPOSI 2022-2023. So please welcome Dr. Shubhangi Bhave.
Hello, everyone.
Hello, ma'am. How are you doing?
Good. Good evening to everyone.
Good evening. The next speaker is actually one of my best friends, and we were batchmates in MBBS. And we both did our MBBS from NKP SIMS, that is NKP Salve Institute of Medical Sciences, and Lata Mangeshkar Hospital, Nagpur. Then she moved on to do her MS in ophthalmology from a reputed institute, MS Ramaiah Medical College in Bangalore. She finished her fellowship recently at Mahatve Eye Bank Eye Hospital, and she is currently working as a phaco surgeon and medical retina consultant. Please welcome my dear friend, Dr. Pankhuri Agrawal Dhande.
Hello all. Thank you so much for the love and adulation, and I'm very glad to be here. Hello, ma'am. Hi,
So,
Surabhi.
yes, welcome to our show, and let's immediately begin with the topic. So,
Yes.
जो मुझे आज
Yes.
इतना टॉर्चर किया गया है बहुत सारे मैसेजेस से कि व्हाई वुमेन्स मेंटल हेल्थ, सॉरी मेरे दिमाग में मेंटल हेल्थ ही आता है बिकॉज आई एम अ साइकियाट्रिस्ट. तो व्हाई वुमेन्स आई हेल्थ, ओके व्हाई इसको स्पेसिफिकली आज क्यों इस पे बात करनी चाहिए, तो क्यों आर देयर एनी डिफरेंसेस इन बिटवीन मेंस एंड वुमेन्स मेंटल आई हेल्थ?
You want me to take it?
Yes, Dr. Bhave,
Surabhi?
please
Yeah.
start. Yeah.
I'll
Yeah.
just add on there.
Yeah. So, basically, there's not a lot of difference between the men and the women's eye, but certain conditions are more common in women because they have a longer lifespan. If you see an average lifespan of a man and average lifespan of a female, then average lifespan of a woman is about 5 to 6 years more than that of a man. And because of this, certain conditions like the age related macular degeneration, cataracts, all these aging diseases are seen more commonly in the females. Secondly, dry eye, which is a condition which may not affect the vision but definitely affects the quality of vision, is more commonly seen in females. And certain diseases like the autoimmune diseases, the lupus or the arthritis, and the eye diseases related to that are more commonly seen in females. So these are certain differences where we have the females having prone to these diseases more than men.
All right. Thank you, Dr. Bhave. Dr. Pankhuri, would you like
So,
to add on to this question?
as ma'am said everything just correctly said, there are few certain things which I'll just add on. As we know that women, we are marinated in hormones and we really do have a lot of phases. There is puberty, there is childbearing age, then there is childbirth, premenopausal, menopause, and postmenopausal. During all these phases, we actually tend to have a lot of fluctuation in the hormones. And as we know that these sex hormones, estrogen, progesterone, they do have a lot of effect in eyes because they do have a lot of receptors in several parts of the eyes. It's actually a very detailed thing. But I guess this is the main one of the reasons. One is life expectancy for sure, because all these conditions are also age related and age dependent, but also the hormonal changes with which we suffer, with which we carry forward in our life. During, for example, during menopause, there is sudden drop of estrogen, which definitely has a lot of impact in tear films because there are so many receptors in lacrimal glands, meibomian glands, which kind of impairs our tear film, and it impairs the quality as well as the quantity of it. They are actually it's a different it's an individual question altogether because there's a whole lot of entities when we talk about the hormonal changes, and I guess you'll have questions further in the show, Surabhi.
Yeah, absolutely, Pankhuri. I was actually about to stop you so that, otherwise we'll run
Yeah,
out of questions. Yeah.
I know.
Okay. So now you have already mentioned certain conditions, but can we actually elaborate a bit on these common conditions that women suffer from? And just very briefly, so that the audience understands what these each of them stand for, or what happens, what symptoms happen during these.
Ma'am, you want to go ahead?
No, you go ahead.
Okay, as ma'am said that because women, we have a longer life expectancy. I think I'll start with age-related macular degeneration, which is one of a major entity among all these conditions. And what happens in this is that it affects our central vision. So घर पे
थोड़ा
जब
पंखुरी
भी
आप हिंदी में भी समझाए कि ये होता क्या है, तो ताकि
बिल्कुल
जो
बिल्कुल
हिंदी स्पीकिंग ऑडियंस है उनको भी समझे.
यस तो जो हमारी माएँ हैं, नानी हैं, दादी हैं, स्पेशली द वी आर टॉकिंग अबाउट द एज्ड women in our family, तो वो जब न्यूज़पेपर पढ़ती हैं या फिर सिलाई करती हैं या फिर किचन का कुछ काम करती हैं, पास का कुछ काम करती हैं, वो धीरे धीरे उनकी कैपेबिलिटी कम होती जाती है. अब ये एक एंटिटी है, जैसे कि मैम ने कहा, there are several factors and which are autoimmune factors. Now, autoimmune is actually an umbrella term. There are many conditions which come under this. For example, rheumatoid arthritis, as ma'am said correctly, there is diabetes, rheumatoid arthritis, as I said. Diabetes हमने बहुत commonly सुना हुआ है, औरतों में होता है ये. अब इसमें क्या होता है कि आपको पता नहीं चलता है इनिशियल स्टेजेस में आपको डायबिटीज है. इट्स बेटर फॉर अ प्रेग्नेंट वुमन टू ऑलवेज गो एंड गेट स्कैन. आप एक बार अपना आई एग्जामिनेशन कराइए, आप अपना एक बार रेटिनल एग्जामिनेशन कराइए, डायलेटेड एग्जामिनेशन कराइए. कई बार ऐसा होता है कि वो औरतें जिन्हें पहले डायबिटीज नहीं था, बट वंस दे गेट प्रेग्नेंट, दे हैव दिस एंटिटी वेयर द ब्लड शुगर शूट्स अप, विच इज जेस्टेशनल डायबिटीज. उसमें भी आपको आई में प्रॉब्लम्स हो सकते हैं. तो इट्स ऑलवेज बेटर कि एटलीस्ट जो प्रेग्नेंट फीमेल्स हैं वो हर मंथ नहीं तो एटलीस्ट हर ट्राइमेस्टर में अपना एक बार आई चेकअप करवा लें, बिकॉज दे आर यू नेवर नो, वहाँ पे हमारे रेटिना के पीछे जो हमारी सबसे अंदर की लेयर है, हमारा पर्दा, उसके पीछे पानी जमा हो जाता है. एंड एज वी नो दैट प्रेगनेंसी इज एक्चुअली नथिंग बट इट्स लाइक इट हैज अ लॉट ऑफ फ्लूइड रिटेंशन, जो कि हमारी आंखों में भी असर करता है. इसीलिए हमें ये सारी चीजें देखनी है. आपने कई बार देखा होगा कि जैसे हमारे क्लिनिक में भी women they come, especially the women who are pregnant, they come and they say that they have blurry vision. वो इस टाइम पे ब्लरी विजन इसलिए होता है क्योंकि उनका जो क्लासेस का नंबर है वो थोड़ा बहुत फ्लक्चुएट होता है, वो थोड़ा बहुत चेंज होता है. उसका मेजर रीजन यही है कि जैसे मैंने आपको बताया कि हमारे पर्दे के पीछे थोड़ी स्पेलिंग आ जाती है जिसको हम मैक्युलर एडीमा कह सकते हैं, gestation डायबिटीज में कुछ चेंजेस होते हैं. तो इसमें nothing to worry about, but the important factor is that you should get it screened. You should always have a follow up ताकि आप उससे रिलेटेड ट्रीटमेंट ले सकें. तो आप एटलीस्ट हर ट्राइमेस्टर में जाके अपना आई चेकअप करवाएं. मैम, एनीथिंग यू वांट टू ऐड?
या अब ये डिसीजेस तो हैं और एक सोशल रीजन है जिसमें लेडीज का चेकअप थोड़ा डिले हो सकता है. Most of the places they are not the breadwinners of the family, so there's some degree of neglect which we can perceive in the checkup of a female, and that is one reason why females may suffer more, and they don't even want to report any problem in them in order to cause the additional expenses in the family, all these things.
Correct. Ma'am, there are two actually incidences because we tend to notice that as women, we tend to prioritize our family members over us. Their health, their eye problems come prior to us, and we tend to neglect it. Actually, हमारे clinic में भी ऐसे ही हुआ था 2 बार. There used to be a mother who was a single mother. So she used to come and get her son along, जो exams दे रहा था, teenager son था, and she used to come for his glasses. एक बार जब उसको मैंने ऐसे lubricating drops दिया and she came back, she was not able to read the जो हम लिखते हैं eye drops का नाम eye bottle पे, she was not able to read it. I just casually told her कि एक बार आपका एक test कर लेते हैं. She actually had a grade 3 cataract which she was neglecting since years, and on prior examinations हमें पता चला कि early glaucomatic changes भी हैं. धीरे धीरे फिर explain किया, उनके बेटे को explain किया कि थोड़ा regular follow up लगेगा उनका भी, because obviously we know, I mean, if we are educating a woman, we are educating like the whole community. ऐसे एक और instance था जिसमें wife used to come and she used to come with her husband. उनके husband का हमारे यहाँ पे cataract surgery हुई थी, तो she used to come for several follow up, and एक दो बार ऐसा हुआ that I had noticed redness in her eye. मैंने उनसे just ऐसे casually पूछा, and she had never got her examination done. And she always used to say कि मैम कुछ नहीं, बस थोड़ा सा infection हो जाता है मुझे, तो ऐसे एक दो बार वायरल हुआ होगा, उसके लिए मैं ड्रॉप्स ले रही हूँ. And she used to take moxifloxacin. जस्ट क्योंकि उसने हिस्ट्री ऐसी दी और मैंने ऐसे जस्ट उनको थोड़ा एक्सप्लेन करके इनका एग्जामिनेशन किया, so she had a little bit of redness जिसको हम थोड़ा बहुत superior limbic keratoconjunctivitis कहते हैं. I just had a little bit of doubt. I explained to her and we got a battery of tests done, and then she came out the RA factor was positive and she was a patient of rheumatoid arthritis. At least now she's taking the treatment and she's under treatment and doing quite well. So with this at least talk, we can tell our women that it's okay to prioritize our members' health, but you need to keep a check on your eyes as well.
Absolutely, that's a very strong message that needs to go out in the society. So thank you for that. Also, can you like briefly in 2 lines just explain, क्योंकि ये words बार बार आ रहे हैं, cataract और glaucoma, तो ये होता क्या है and इसमें क्या symptoms दिख सकते हैं women में?
So basically, cataract is clouding of our crystalline lens. The image which is focused on the retina is because of two structures. One is the cornea, which is the front transparent layer of the eye, and second is the crystalline lens, which helps us to focus the image on the retina. So when this crystalline lens becomes opaque because of aging, it is nothing like whitening of your hair. Your lens becomes white, and so you cannot see. And this is cataract. And in cataract, if you do the surgery, you replace this opaque lens with the artificial lens, your 95% of the vision is restored. But what happens in glaucoma is the nerve of sight or the optic nerve is damaged because of either increased pressure in the eye or decreased outflow of the fluid from the eye. And if the pressure in the eye rises, then it permanently, and because of this, whatever vision loss is there in glaucoma cannot be recovered. It can be recovered only in the early stages, but in the later stages, we cannot recover the vision which is lost. So, glaucoma is more dangerous in terms of recovery of vision. And so, the screening which Pankhuri was talking about is so important in cases of glaucoma. We need to screen everyone's eyes at the age of 40 or 45, because after that, all these conditions can be there. And glaucoma, particularly, is a silent killer. It has no symptoms and can only be diagnosed by proper screening of the eyes.
Okay. Thank you, ma'am, for the detailed explanation. ऑल्सो हम प्रेगनेंसी की थोड़ी बहुत तो बात कर ही चुके हैं कि प्रेगनेंसी में क्या होता है क्या नहीं होता है. So it's, as we know, it's a hemodynamic condition. It's also hormonally dynamic. Everything is dynamic in pregnancy. So इसमें precautions क्या लेने चाहिए women with pregnancy में eye conservation के लिए precautions क्या लेने चाहिए?
Pankhuri, tell. Pankhuri, you go ahead.
Yeah. Okay, ma'am. Yes, ma'am. Ma'am, I guess to begin with, if a woman is planning to get pregnant, first I guess basic routine screening of her glasses prescription, starting with that, and then a detailed examination, including retinal examination, dilated fundus examination, everything I think should be done. And later on, when there is follow-up, the later follow-up, if a patient has, as I think we mentioned in the talk, that there could be entities like if a pregnant woman has hypertension, then if there is preeclampsia, eclampsia. So then the follow-up can be actually made a little like maybe every 2 monthly, because then patients they tend to have hypertensive retinopathy as well. They could be, अगर हम simple भाषा में बताएं तो वहाँ पे हमारे पर्दे पे खून निकल सकता है, which is retinal bleeding. There are several entities as well. कई बार आखिरी स्टेजेस में ऐसा भी हो जाता है कि पर्दे के पीछे फ्लूइड जमा हो जाता है, जिसको हम सीरस रेटिनल डिटैचमेंट कहते हैं. ये हुआ एक्लाम्शिया प्री एक्लाम्शिया की बात. अगर जैसे जेस्टेशनल डायबिटीज की बात थी कि हम हर ट्राइमेस्टर में एक अपना आई चेकअप करवाएं in order to see whether there is any diabetic retinopathy changes happening or not. इसके साथ साथ अगर कई बार ऐसा होता है कि there are women who come to our clinic and they have, as I was saying, with the glasses, they have blurry vision. But उस टाइम पे हम उनको ये बताते हैं कि this is just temporary, because there is this condition of fluid retention. आपका वहाँ पे स्वेलिंग भी है पर्दे के पीछे, तो ये यूजुअली डिलीवरी के बाद और या फिर आप जब लैक्टेट करते हो उसके बाद आप इस नंबर को आप वापस ला सकते हो. आई मीन इट्स जस्ट अ टेम्पररी फेज. यू डोंट एक्चुअली हैव टू चेंज योर ग्लासेस. आइडियली तो ऐसे स्टेजेस में हम लैसिक सर्जरीज और कॉर्नियल ये सर्जरीज भी नहीं करते हैं, रिफ्रैक्टिव सर्जरीज, because there is a lot of fluctuation which is happening even in the refractive error. I guess this is it, Surabhi.
I think prevention is by getting your eye checkup regularly, or if it is recommended by your gynecologist, get it checked. If there is an evidence of narrowing of the blood vessels in the eye arteries, especially, then it helps the gynecologist to take a proper decision regarding your pregnancy and assessing the threat to the vision.
Correct.
Okay. ओके सो मूविंग अहेड, जनरली हम हमारे सारे ही सेशंस में जो भी कंडीशन के बारे में बात कर रहे हैं उससे हम लोग डेफिनेटली ये क्वेश्चन तो पूछते ही हैं कि सब्सटेंस अब्यूज का आई हेल्थ के ऊपर क्या असर होता है. सो आर देयर एनी सब्सटेंसेस दैट कैन कॉज आई डैमेज, एंड इफ दे डू, what kind of damage happens and what precautions can be taken again in this?
So I'll tell about alcohol. Alcohol will cause a toxic optic neuropathy. So it will affect the vision in the eye by affecting the optic nerve of the eye. Then tobacco can cause a lot of damage to the eye by causing the vasoconstriction. It constricts the vessels of the eye. So again, we can have a damage to the optic nerve, damage to the retina. So these are the two things I have noticed about the substance abuse in the eye. So, Pankhuri, if you can add something
Ma'am,
to
yes,
this.
ma'am. Just to add on this, there is one more very common addiction, which is smoking. And it's good that I think lesser women go towards this direction of smoking. But still, smoking is also something which has to be stopped or shouldn't be started in the first place. So basically, smoking में भी क्या होता है कि there occurs this vasoconstriction. Also, there are several entities जिनका progression बहुत ज़्यादा बढ़ जाता है, कई folds बढ़ जाता है. If you talk about, as we talked about, age-related macular degeneration, uh, जो females smoking कर रही होती हैं या not just females, men, women, both, they have it's been seen that there is a 10 years early development of age-related macular degeneration. They tend to develop this entity 10 years prior. And also, if there are two conditions in age-related macular degeneration, एक होता है dry और एक होता है wet. तो जो progression होता है dry का wet में, that actually progresses faster in people who are smoking, who are smokers. Or फिर wet age related degeneration is much difficult to tackle with. उसमें injections लगाने पड़ते हैं, कई बार lasers देने पड़ते हैं, but it's still difficult to deal with. ये तो एक entity की बात हुई. But there are several factors, like as ma'am said, there's this toxic amblyopia that actually as well occurs with smoking. If you talk about diabetes may
What is
जो इसका
amblyopia?
progression, that is actually ma'am.
Amblyopia. We are talking about toxic amblyopia. That is the dull vision due to the toxins like alcohol, nicotine, all these things. So, otherwise, amblyopia also occurs due to different factors, but we're not talking about it here.
Yeah.
Another thing is even smoking or nicotine can worsen the thyroid ophthalmopathy. The ophthalmopathy related to thyroid eye disease, basically hypothyroidism, can be aggravated by smoking. So we tell them to stop smoking
Correct.
in thyroid eye diseases.
Are there any other substances like marijuana or any other substance?
I'm not
Because
aware. I have
nowadays
not.
marijuana is also very
Yeah,
commonly taken
I know.
in
I
our
know.
society. Yeah, so that would be a
We
pertinent question
Probably
for a
definitely
lot
the
of
only
audience.
other thing is ki they neglect their health and certain nutritional deficiencies. All these could happen because of the substance abuse. But as such, I have not
see
come across
also
any.
if you talk about,
Yeah, Pankhuri,
yeah,
continue.
Sylvia, as we're talking about the other substances, obviously they will definitely hamper our optic nerve, will lead to toxic optic neuropathy, and will definitely not be a healthy way. You know, we can't say that we have to take this for our development of optic nerve. So definitely all these substances should be avoided, and some way or the other way it definitely affects optic nerve. And actually, this is something which cannot be recovered then.
Yeah. Okay. So now that we also talked about nutrition, neglecting one's nutrition. So what are the dietary recommendations that are given to women so that they can have a good eye health?
Actually, nothing specific to women, but a balanced diet goes a long way in keeping your eyes in a good health. So, a diet which is rich in vitamin A, rich in vegetables, and vegetables provide a good source of antioxidants, and so doesn't the oxidative stress is reduced on the eye. So, age related macular degeneration, all these conditions can be reduced by having good and balanced diet.
Yes,
Okay.
just to add
Uh,
on what ma'am said,
Yeah.
If we're talking about age-related macular
Yes, continue,
degeneration,
continue, continue.
yeah. So there was actually a study which was done, age-related eye disease, and the modified version of it, which is AREDS2. That also states that there are few certain compounds which were found to be, improving the health of the retina, which is lutein, zeaxanthin, and these are very easily found in fruits and vegetables which are easily available in markets. So, like for example, lutein is easily available in spinach, kale. If we consume a lot of oranges, tangerines, we get a lot of zeaxanthin. So, as ma'am said, like all these berries, fruits, it's not just the fancy items, not just the fancy vegetables like broccoli, but also tomatoes. They are rich in vitamin C. Are all these grains which we use, they are rich in vitamin E. So it's basically just to have the daily nutrition, which is good, and green leafy vegetables, not to include all those fancy items all the time, but definitely berries, citrus fruits are good source of vitamin C. And a good balanced diet will for sure help you out with your eyesight.
Okay. Okay. So, moving ahead, uh, prolonged digital screen exposure can cause eye issues, I think, in everyone, almost everyone. So, what is your advice for such people who actually have their work related to digital screens and they have to, like, there's no other, they have no other choice. So, what would be your recommendation?
So, the digital eye strain is there in both men and women, but in females, as the dry eye is more common, especially after the age of 40. So, maybe they are going to be affected more because of the digital eye strain as compared to their male counterparts, provided they have the same working hours. And the the best advice I give them is a 20-20-20 rule. That is, they look at a distance of 20 feet for 20 seconds after 20 minutes of the work on their digital instruments. So, just a small break. It can't follow it right to the letter, but I always tell them that just look away so that constantly you're focusing on your screens, laptop, and because of this, there is a eye strain on the muscles. People even forget to blink, and that is what causes the ocular surface
Yeah.
dryness. So, all these things can be taken by following a good computer hygiene or good hygiene for screen, and that will go a long way. And of course, the night sleep is very important. It is restorative. I've seen that in young kids nowadays, young children or young adults, they don't sleep till very late, till 2 o'clock, 3 o'clock is the norm. And so that is not a very
Yeah.
healthy practice from my point of view. Pankhuri, you can add some.
Yes, ma'am. Ma'am, I guess as you said, there is this thing also that when women need to look after their toddlers, they tend to like choose their work from home job, and that also has added a lot of load in this in this phase of women where they have a lot of screen time. And as ma'am says, 20-20-20 is what we tell them for computer vision syndrome. I guess one more thing, which is these young girls, they are more of the school going age, they have this nearsightedness, and we just explain to their parents, better to let your child go outside, play outside for few hours. सिर्फ घर पे बैठ के फोन देखना, ये तो एक बहुत कॉमन चीज है जिसमें यंगस्टर्स आते हैं, बच्चे आते हैं, वो फोन पे रहते हैं, ऑल थैंक्स टू द इंस्टाग्राम एंड ऑल दीज वीडियोस. Just बाहर जाए, have an outdoor activity of 2-3 hours a day. That will also help a lot.
Okay,
Yeah,
that's
Surabhi.
a very sane advice.
Yeah.
Lastly, I think we had a question flashing. Admin, could you please flash the question? Okay, the question is from Siddharth Dhande. What are the benefits of apple cider vinegar on the eye?
I think Pankhuri can take that.
Yeah, firstly, apple cider vinegar, it's not proven that it improves eyesight, but definitely it's a healthy lifestyle. If you can incorporate it, it will definitely help you in your in your general body health. It does have something. It has antioxidants which help you getting rid of all the free radicals, and somehow definitely it helps in eyesight or in your general eye health. I guess this is the answer.
Next question is from Sanjeev Chakravarti. Eyes
Yes.
being indicator of heart health. So, are you saying आंखें भी होती है दिल की जुबान?
Yes.
That is so true.
The eyes, we can see the blood vessels, which we cannot see anywhere else in the body. And the blood vessels are indicator of the overall health of the blood vessels in the body, not only heart, brain, kidney, everything. And so, like sometimes when we look into the fundus of the patient and we see narrowing of the arteries, we tell them, do you have a blood pressure? So the patient is very surprised that, madam, how can you say that we have a BP after looking at our eyes? So a lot of things we can make
True.
out from the heart. There are yellow deposits into the eye. We may it may indicate that the serum lipids or cholesterol is high. So eyes do tell us about the health of the heart.
It's completely true. Eyes are gates to your soul, and it's actually a gate to your whole body in general. As ma'am said, every single thing, all the systemic, not all, but many of the systemic comorbidities can also be seen when we do our eye checkup.
Wonderful. Okay, the next question is what is autoimmune uveitis?
Autoimmune uveitis is uveitis means the middle layer of the eye is known as the uvea, that is choroid at the back, ciliary body, and iris in the front. So whenever there is an inflammation of this, we call it as uveitis. And when the cause is autoimmune, we call it as autoimmune uveitis, as in rheumatoid arthritis or other autoimmune conditions, the lupus erythematosus, and all those. So here, our own body's proteins are fighting against our own body's cells. So you get an autoimmune reaction, and the best way to treat is with steroids.
True.
Another
हमने कई बार
question.
ऐसा देखा होगा.
Okay, please continue, Pankhuri.
Yeah. And you can take the
बहुत
next
बार ऐसा
question.
होता है कि
I mean, you finish this, whatever you're saying, and then you could take the next question
या
as
या
well. That's what ma'am meant. Yeah.
या बहुत बार ऐसा होता है कि एल्डरली एज ग्रुप आजीज और काकूस आते हैं हमारे क्लिनिक में, और उन सबको कभी कभी ऐसा होता है कि घुटनों में दर्द हो रहा है, हाथ में दर्द हो रहा है, नीज, शोल्डर्स, ऑल ऑफ दीज जॉइंट्स आर इन्वॉल्व. अगर उन्हें ये सारी एंटिटीज होती हैं, लाइक फॉर एग्जाम्पल रूमेटॉइड आर्थराइटिस, then they are actually prone to condition as the question was autoimmune uveitis. इसमें हम उनको वही बताते हैं कि उन्हें फिर ऐसे में बहुत फ्रिक्वेंटली एपिसोड्स ऑफ रेडनेस, पेन, मेनली स्पेशली रेडनेस और पेन होता है. उसमें 2-3 एंटिटीज तो आती ही हैं. तो फिर हम उनका चेकअप करते हैं और उनको फिर इस पे रखा जाता है, जैसे मैम ने कहा, स्टेरॉइड पे रखा जाता है.
Okay, so the next question is what is the incidence of uveitis in ulcerative colitis and how is the severity correlated with disease activity in ulcerative colitis? Okay, so it's gastro plus ophthalm.
Ma'am, you want to take this question?
No, take it, take it.
I guess it's way past our domain. So
Basically, there is a correlation between, there is an association of ulcerative colitis with uveitis in certain conditions. And whenever the disease is active, ulcerative colitis, you can have repeated incidences of uveitis. So, unless you control the ulcerative colitis, the incidences of uveitis also will not be controlled. So any diseases, you have to control the basic disease, like in rheumatoid arthritis or Sjogren's or other conditions. Unless the basic disease process is corrected, the inflammation in the eye goes on again and again.
Okay, I hope that answers that. Lastly, I got a question that is blindness more common in women? And then what is the prevalence in between like men and women? And what is the advice that you generally give a blind woman?
I wouldn't say that blindness is more common in women, but maybe if you consider the longevity and if you consider the number of years she stays, maybe central blindness or the central useful vision is more commonly lost because of age related macular degeneration. And it is difficult to counsel a blind woman. I would send her to Dr. Surabhi Mitra.
Okay, thank you so much, ma'am. That was a compliment, actually. Uh, yeah, so we have another question. What are the causes of Kaiser Fleischer ring apart from Wilson's disease in women?
In women, I think Pankhuri should know that, because I just know that it is in the Wilson's disease.
Wilson's. Yeah, that I also know. Wilson's में होता है. उसके अलावा भी कुछ है
ma'am,
क्या?
I think whenever there is, ma'am, I think whenever all the conditions, any other condition where there is increase in serum copper,
So, traumatic foreign
and
body, there
they,
is a foreign body in the eye, we can have a case ring. I think so.
yeah, any condition, yes, correct.
Okay, Dr. Surbi, Dr. Siddharth Dhande needs to be invited for a gastro episode. Yeah, yeah, I am planning to get him. I am
This
roping
is
him
some
in next time.
enthusiastic spectator of yours.
Okay,
Kind of.
Anand Khare is asking, any incidents of specific eye conditions that we need to look out for in females while seeing patients in our routine OPD?
Incidence of specific eye condition.
Ma'am, I guess, correct me if I'm not wrong. I mean, there's this thing of cosmesis. Women tend to wear contact lenses much more than men, but definitely there's refractive error as well. But if suppose if we tend to sleep on with our lenses, we suppose if people take showers with the lenses, or if the lenses are put in our eyes for more than prolonged hours, of more than maybe 8 hours, then they can definitely come to our OPD with redness, watering, some foreign body, or some this thing, photophobia.
Yeah, I think he must be pointing out towards narrow angle glaucoma, is if that is what Dr. Anand is pointing out at. Narrow angle glaucoma is more common in females than in males. So we have to look at the anterior chamber depth. If it is narrow on slit lamp, then they are more prone to have a narrow angle glaucoma. The female
I just remembered. Yes, ma'am, please. Sorry.
female preponderance is very much more in narrow angle glaucoma.
Okay. So I just remembered a very interesting case I had in my OPD. So there was this, as Pankhuri was talking about lenses, I had this man come into my OPD, and he said he had those red eyes and watering eyes, and he was constantly trying to pull something out from his eye. And I was thinking, why was he sent to me? Why wasn't he sent to the ophthalmologist? And later, when I saw his file, it was like he had been to the ophthalmologist, and it appears that he had removed his lenses, but he still had some foreign body sensation in his eyes, and he was literally trying to remove his cornea later. So that is the reason he was sent to a psychiatric OPD to, stop with the obsessive behavior. So
Yeah,
that is one
it
very
actually does
interesting case.
happen. It does happen a lot.
Okay,
It's been
how many
where we
hours
used
can
to
we
get
wear?
emergency calls.
Yes.
Yes, Pankhuri?
It has happened actually. We used to get emergency calls from, suppose if a person had been drinking, suppose if there was a woman who had been drinking and then she had come saying that the lens is somewhere lost in the eye. And she was like, it's somewhere out, it has fallen out. But we have removed it has happened, we have removed lenses from the cornices as well. And the woman had come actually the next day. She had slept off with the lens in the fornix. There was a lot of discharge as well after a few days, redness, it had keratitis. So this you need to be very careful when you're wearing your contact lens.
We can wear contact lenses. Actually, how much we can wear the contact lens depends on how many years we are wearing the contact lenses. Initially, we can tolerate contact lenses for even 10 hours, 12 hours a day. But as our wearing years progress, then our tolerance to contact lens becomes less, because the oxygen carrying
Okay.
of the lenses becomes so I cannot breathe with the contact lens on. And so it is safe to say that you can wear 6 to 8 hours of contact lenses without much of a problem, but shouldn't wear it more than that.
All right. So, admin, any more questions? Because we have almost reached the end of our show today. So, are there any more questions to be flashed, or may I continue with the signing off? Okay, so I think I will continue with the. Okay, there is a question. No, not a question. Thank you, Dr. Surbi and Dr. Pankhuri Agrawal, for such a nice webinar, and also, of course, Dr. Bhave. Thank you, Nilesh. Um, yeah, thank you, Dr. Shubhangi Bhave, ma'am, for the tips. Yes. Okay. So, thank you very much to the audience for attending this live today, and asking questions and being very interactive in the show. It was amazing. And Dr. Bhave, Dr. Agrawal, I don't know where she disappeared. Probably she has some network issue. But thank you so much, both of you, with your, ma'am, expertise in the field of 40 years, and Pankhuri being a newcomer in the field. Both of you were very informative. You did really well, and thank you so much for being so crisp and as well as elaborative at the same time. So I am sure it helped a lot of people in the audience today. And as this live will be continuing on YouTube, it will be released on YouTube immediately after this live ends. So people can continue watching it through the same link that we had sent you.
Thanks.
Also, yeah,
Sorry.
yeah.
You
No,
continue.
no. Okay.
Just going to
Uh,
thank you and Sanjeev for and Pankhuri
Hello, hello.
for the show. Yeah.
yeah, Pankhuri, we can hear you
Hello,
now.
ma'am. I'm so sorry. There's a feeble network here. I lost the connection in between. I guess we are just wrapping up the show. So just a few words of parting. I just want to say that let's just prioritize our eyes and understand and acknowledge that our eyes are precious. And there are certain things which need to be followed. Just a regular eye examination for screening purpose. If there are no eye conditions per se, then I think annual examination will. But if the condition, say, if you have diabetes or hypertension, then definitely follow your follow the instructions of your doctor and do the follow-up accordingly. Hello?
Yeah,
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 yeah.
we can hear you.
She can't hear us.
Yeah.
Yeah.
Hello?
Okay. Yeah, Pankhuri, we can hear you.
Connection is gone.
Yeah.
And
Okay. So,
your eyes, and they'll take care of you. That's their message.
sorry, ma'am, could you please repeat it?
Take care of the eye. Take care of your eyes, and they will take care of you.
Oh, beautiful. Beautiful parting note. Uh, Thank you so much again. And at Evrox Healthcare, we come up with such informative shows with informative speakers constantly, or we try coming alive on every Saturday or at least every alternate Saturday. So please do keep on attending and
Hello?
supporting us likewise. And Evrox Healthcare has also come up with the F1 app where we are recruiting doctors and medical professionals. So please do ask for the demo. The number will be flashing soon beneath, and you can contact on that number for the demo. Ma'am and Pankhuri, you can directly contact Sanjeev anytime, and you can get even teleconsultations from all throughout the nation. Uh, and as we know that the audiences have always enjoyed our informative shows, so please like, share, and subscribe, and keep commenting for what else you would want us to cover in the upcoming shows. Thank you so much. Signing off, Dr. Surabhi Mitra.